everyone, my name is Jennifer Taj, and today I want to talk about my research paper that I wrote for evidence-based class. And my topic is about nurses and COVID-19. As we all know, COVID-19 has been really stressful for everyone, not just for healthcare workers, but for everyone out there, because we have to be wearing our mask, we have to be distancing from other people, and not being able to have fun activities like birthday parties or other things. But today I wanted to talk about nurses specifically because I will become a nurse and I feel like this is a really important topic to talk about. I work as a nurse tech in a COVID unit, and this right here is how we have to be, not the entire shift, but whenever we're going to go into a patient's room. And this right here, it's how nurses at the beginning of the pandemic had to be the 12-hour shift or 16-hour shift or all the time that they were working with them. When I was reading some articles for my research paper, I learned that nurses in China, they didn't have the appropriate material or mask, gowns and everything to be protected from this virus. And because of this, it was creating a lot of stressful moments, and a lot of nurses were dying too because they were getting infected. There was a survey that was given to them, and only 527 nurses in China were able to answer this survey, and the questions were related about stressful environments and how they were feeling while working with coronavirus patients. And the results were that many of them were feeling overwhelmed because they didn't have a lot of staff. They were feeling depressed because they were away from their families, and they were also feeling very tired because they had to work extra hours, extra days to take care of these patients. The numbers of patients with COVID-19 were getting higher and higher each day. And because of this, the nurses had to stay longer hours and work extra days to take care of their patients' needs. This is why it is really important to talk about burnout and how to prevent any emotions or emotions that can harm a nurse's life. For example, one of the articles that I read about was talking about nurses feeling like they were not feeling safe at work, or they were not being taken care of like they were supposed to, like being like for example, like having enough material or having the things that they needed to take a better care for patients, and also protecting themselves, which is true, because this virus can kill you, and or it can make you really sick, and you can have some effects after having COVID-19. The emotions that the nurses were having back in China were bad, because the virus started there and they were not sure how to protect themselves at the beginning. So that was giving a lot of stressful moments and making the environment really stressful for them to work. As I mentioned before, a lot of nurses were dying. Not only nurses, but doctors or people that were in contact with the COVID patients. And that's why it was very important to do this survey, so they could figure it out, a time or a place that they could work on these problems for the nurses. And the nurses during this pandemic have been the heroes. Not only nurses, but all the healthcare workers. But the nurses, they work more bedside to bedside with them. So I believe that nurses spend more time with this kind of patients. And for example, the ICU that I work at, we have ECMO patients, and ECMO patients, they're very very sick patients with COVID. And the nurses, some of the nurses didn't even have a break to go to eat, or didn't have a moment to go to the bathroom or restroom, sorry. And that is really bad on their health too, because they needed time to get away from all the stressful moments, and they also need to use the restroom. So when I was reading about the nurses in China, they were really stressful. They were really sad because they couldn't see their family, they couldn't spend time with them. Also, not just because they were taking care of their patients, but because they were being really careful. They were being really careful not to infect other people, because this virus, you can contract it really fast. So the nurses were working hard. They were working long hours. However, there were not enough staff to take over them whenever they were feeling tired. So they had to work under pressure, and that brought a lot of emotional feelings. Like I mentioned many times, stressful moments, which is not good for our health. They were depressed, and then some of them even really felt like they were not being protected from this virus. There are very important things that we can do about this. Back in 2020, when the pandemic started, they were not really sure how to manage all the situation. But now that we are in a different year, I believe that it's very important to bring helpful ways to prevent burnout from the nurses, and to prevent any emotional feelings that the nurses can have, and that can take you or take them to a higher risk emotion. As I mentioned before, being stressed and as a nurse and having to take care of COVID patients is not the only feeling that they feel. Sometimes these nurses take more than they're supposed to take. Like, for example, I was with one of my articles, it said that some nurses were taking more patients than they were supposed to, but that was because they didn't have enough help to do this. When this pandemic started, it just went crazy, and a lot of people were dying right and left, and or getting very sick, so they had to stay at the hospital. So because of all of that, their emotions were really affected, and not having a supported system like family or just a break, a moment to just take a break for themselves, it was really impossible back then, because they didn't have the staff, they didn't have the time to do that. So they have to work under pressure. They had to take care of these patients that they were dying from coronavirus. And also, while wearing all the protective stuff, it can be really uncomfortable. It can be really it can get you tired, because it can be really heavy. And so I have experienced it, and I know it hurts. The side of the face, it hurts a lot having that mask on for 12 hours or more than 12 hours. And I believe that nurses back in China, when this pandemic started, they were doing their best to take care of the patients and to take care of themselves. However, they were really strong, because COVID-19 was really affecting them emotionally. Not only just because they were not having free time, but because they were seeing a lot of patients die. So they had to be dealing with their own emotions and then seeing patients die. And sometimes these patients, or not sometimes, most of the times, patients were dying by themselves because family members were not allowed to be there with them. So that said, that can bring more stress for the nurses, because that brings more painful memories for them, like seeing patients dying this way, or not being able to help them the way they want to save their lives. So I believe that nurses back in China were working hard since day one, and because of that, some of the nurses were dying too. And because of the nurses dying, they were not having enough people or nurses to help them take care of patients that were coming in every day or every hour because of COVID-19. As we can see, this picture right here is just very sad, because the nurses, sometimes the nurses are not are not how can I say this, sometimes a lot of the nurses go through a lot of emotions and they don't really express it. So this is why it's really important to talk about it, to find ways that we can help nurses, especially during this pandemic, because it is just very stressful for them. It is, and it can bring depression, not only depression for that short moment, but depression for the rest of their life, because they can be thinking, they can have PTSD and just be thinking about the patients that they were taking care of, and just seeing them die and not being able to help them get better. It can be really devastating for a nurse. What are some ways that we can help the nurses with these emotions, or just preventing them from feeling stressed and feeling like they're not doing anything, but we can see that they're working really hard, especially during COVID-19. I believe that there are a lot of ways that we can do that. In one of my research papers, we're talking about hiring more people, giving them more time for themselves, like vacation time, or just letting them work short hours instead of the hours that they were working, or just being more flexible with them. And for my experience working in COVID-19 unit, I saw a lot of support from my manager and from people from outside of the hospital. A lot of people were bringing food. A lot of people were praying for us, praying for the nurses as they were working hard with these patients, with COVID-19 patients. And there were also some opportunities to talk to a person about our feelings, just to have like a breakdown moment and talk about what we were going on, what we were thinking, or our feelings after seeing a patient die. I believe that all of this is really helpful, but especially hiring more nurses is very important, because it takes a lot of pressure on the nurses that are on the floor, because instead of having 3 ICU patients, they are able to only have 1-to-1 or just 2 patients, because ICU patients are very sick. And especially for the COVID patients, like ECMO patients, those patients, they require only 1 nurse, because those patients are the patients that are more sick and they can die really fast. So I believe that hiring more staff, more nurses is very important, especially during this time of COVID. And that's what one of my articles said, that back in China, they were trying to hire more nurses, so the nurses that were there could not be really tired like before, like when the pandemic started, and to prevent to get to contract COVID-19 for being with COVID patients all the time. So I believe that all of that is really helpful. And also having vacation time, spending time with their family. As one of my articles was talking about, having more time with their family and going on vacations. As of now, we know that we cannot go to different places to have fun, but we can stay at our house and just spend time with our family. And that can be a distraction, and that can bring more relaxful time for us, or for the nurses, especially for the nurses, and to be away from sad moments, like as I mentioned before, seeing patients die and not being able to help them get better. So all this, it can be really helpful. And also the management, I believe that they have other ways that they can do better, as far as for a nurse to not feel like they are under pressure to take care of all these patients. But that is why it is really important to talk about emotions and ask a nurse how they're feeling, even if they look like they're doing well. It's really important to ask them how they're doing, how was their shift, so they can express how they feel. Because COVID-19 is very, it's not something that we should take really light, because as nurses we see a lot of patients die, but COVID can take patients' life really fast. So I believe that is very important to talk about their emotions and help them prevent from going to feeling like it's time to quit the nursing side.